in, right?
Hello, come in.
Hi, my name is Miss Morgan. I'm one of the RN today. I'm going to check for your cranial nerve assessment today. What's your name?
KY.
And your date of birth?
9990.
Okay, good. I'm just going to wash my hands and draw the curtain for privacy. So I'm going to ask you to close your eyes, and I'm going to let you smell something and see if you could identify it.
Okay, vanilla.
Oh, good. Your cranial nerve is intact for smell. And then the second one, I'm going to go to the optic nerve. They have two fields. Cranial nerve field, visual field, and visual accuracy. For the visual field, I'm going to use a pen light, and I'm going to shine it in your eye and see if your pupil constrict. Okay. Going to do to the other side. Okay, it's intact. And then the next one, the visual accuracy, I'm going to ask you to read line 8 for me.
DEFPOTEC.
Okay. I want you to close your eye. I want you to cover your eyes with one arm.
DEFPOTEC.
And you could repeat it on the other side.
DEFPOTEC.
Okay, so you read line 8 and show that you have 20/20 vision. So the next one, I'm going to do a series of grouping of cranial nerve 3, 4, and 6. These going to check for involuntary movement of the eye and the eyelid. So we're going to use cranial nerve oculomotor, trachea, abduction, and they're all going to check for eye movement. I'm going to use my pen. So I'm going to do a series. So you don't move your head, just use your eyes. I'm going to check up, center, down. I'm going to go back to center. Okay, and I'm going to go this way, center, down, center. I'm going to go side, center, side, one more. Okay, your nerve is intact. And then I'm going to check for the fifth one, the trigeminal nerve. That's for chewing and biting. I'm going to also palpate a little bit on your temporal nerve and your mandibular nerves. And I'm going to open your mouth, and I'm going to ask you to push down. Okay. Okay, no resistance here. So that nerve is intact also. And I'm going to go to cranial nerve 7, that's the facial nerve. I'm going to ask you to do a smile, a frown, a puff up your mouth. Okay, that's intact also. And the cranial nerve 8, auditory. I'm going to ask you to close your eyes, and I'm going to do and you tell me if you could hear the sound on the left hand side. Okay, good. I'm going to repeat this on the right hand side. Okay, very good. That's good, you could hear. And I'm going to group cranial nerve 9 and 10, the glossopharyngeal nerve and the vagus nerve. I'm going to check for gag reflex and also for swallowing. And I'm going to ask you to open your mouth. I'm going to shine a light in your throat. I'm going to check your uvula for symmetry. Okay. And I'm going to put this in your mouth to check. Okay, I'm sorry about that gag reflex. Okay. Also, so that nerve is intact. Also, cranial nerve 11, I'm going to check your accessory nerve. I'm going to place my hands on your shoulder and ask you to shrug it and make some resistance up and down. Okay, down. And I'm going to ask you to turn your head left and right. Okay, center. Okay, that seems intact. And then the last one is the hypoglossal nerve. I'm going to check for your tongue movement. So could you just stick out your tongue for me and move it side to side? Okay. So that concludes the end of our cranial nerve assessment. Everything seems to be intact. Thank you, Miss Young. All right.